Good day. My lecture is about basic principles of peripheral nerve stimulation. Disclosure: this lecture is purely for the sharing of knowledge to those who are interested to learn the basic principles of stimulator. I am grateful for the sponsorship of my accommodation and fare. The content and outcome of this lecture won't be influenced by the sponsor. Nerve stimulator is one of the critical technological advances for several decades in regional anesthesia equipment. Development and introduction to clinical practice in the 1970s and 1980s allows the practitioner to better localize the targeted nerve. Electrical properties contribute to the performance of a successful peripheral nerve block. Nerve stimulation implies application of a stimulus in the vicinity of a nerve in order to elicit a twitch of the muscle supplied by that motor nerve or paresthesia in case of a sensory nerve. There are two terms important to understanding the nerve stimulation: the rheobase and the chronaxy. Rheobase is a minimal current required to stimulate the nerve with a long pulse, and chronaxy is the duration of the stimulus required to stimulate the nerve at twice the rheobase. Electrical nerve stimulation is a method of using a low intensity, and that is up to 5 milliampere, short duration, 0.5 to 1 millisecond, and electrical stimulus, 1 to 2 hertz repetition rate. The objective is to obtain a defined response, and that is muscle twitch, to locate peripheral nerve or nerve plexus with an insulated needle before injecting the local anesthetic in close proximity to the nerve to block nerve conduction for surgery or acute pain management. An important principle is the preferential cathodal stimulation. Nerve is stimulated by an electrode. A cathode, that is the negative side, significantly less current is needed to obtain a response to nerve stimulation, and current flow alters the resting membrane potential adjacent to the needle, resulting to depolarization, which spreads across the nerve. But when electrode is an anode that is positive, the current causes hyperpolarization and a ring of depolarization, and this will result to less efficient in propagating the stimulus. The motor response is objective, reliable, and independent from the patient's subjective response. Even with ultrasound guidance, nerve stimulation is often helpful to confirm that the structure image is actually the nerve that is saw. Unexpected motor response can occur, alerting the operator that the needle tip is already in close proximity to the nerve and the occurrence of a motor response at the current intensity. One can also recognize an intraneural or intravascular needle placement, and this will prevent further needle advancement intraneurally. Thus, it will reduce the risk of nerve injury. Today, a similar but more rapid transition is occurring between nerve stimulation and ultrasound assisted. Most modern models deliver a constant current output in the presence of varied resistance. But there are reasons for failure, and these include the following: inexperienced operator, change in needle position after successful nerve localization before injecting of local anesthetic, and technical difficulties such as inadequate battery power or bad wiring. Benefits of electrical stimulation included perceived improvement in accuracy and visual feedback instead of relying on verbal input. So this is the stimulating needle. So you can see the wires, the connectors, and also the needle and the propagation. The arrow serves as the point of propagation of the current. And the wires, one is attached to the needle, the other one attached to the leads to the patient and attached to the machine. So this is the machine. You can see the control buttons of current, duration, and frequency. You have to connect the stimulating needle to the stimulator, which should be turned on, and set the current amplitude and duration on the desired levels. Current, and not the voltage, stimulates the nerve. Amplitude of those nerve stimulators require constant adjustment to maintain a desirable current output. Ideally, the current output of a nerve stimulator should not change as the needle is being advanced through various resistances encountered from the tissue, needle, and connectors. The current is required to trigger muscle twitch, correlates with the distance for the tip of the needle and the nerve. The closer the tip to the nerve, the lower the current required to induce the muscle twitch, and the acceptable current with twitch is 0.3 to 0.5 milliampere, and once achieved, the local anesthetic can be given. Distance traveled by the charge carriers, and that is the current, is directly proportional to resistance, and decreasing the current once stimulation has been achieved allows the operator to place the needle in close proximity to the target nerve. Constant stimulation of the nerve below 0.5 milliampere but above 0.2 milliampere generally results in a safe, reliable block. Injection of local anesthetic close to but not touching the nerve. But the exact relationship between the needle tip and nerve epineurium is difficult to evaluate. An intraneural injection in needle nerve contact is difficult to detect using electrical nerve stimulation. So this is the pathway, and this is based from my experience for using peripheral nerve stimulator for more than a decade. So you have to connect the needle to stimulator and the leads attached to the patient. These are the settings: 1 milliampere, 0.5 millisecond, and 1 hertz. Then advance the needle until the twitch is manifested. Then you have to identify the muscle twitching to achieve the desired nerve to be blocked. Reorient the needle if the desired nerve is not achieved. Once desired twitch is achieved, lower the current to 0.5 until 0.3 milliampere. If there is no twitch, advance the needle until the twitch is observed and give the local anesthetic. But if it is with twitch, then give the local anesthetic. So to summarize, this is the picture of how the stimulator looks like with the wires and the connectors to the patient, to the needle. So you have this machine as the source of current, and the current transmission is constant. Current is emitted at the tip of the needle, and distance between the tip of the needle and the nerve is close. Nerve responds to the current and transmits the current along the membrane, then stimulate the muscle that is innervated, and this will cause muscle contraction and manifested as twitch. Thank you for your kind attention.